I wanted to make sure that I left enough time to speak to you at the end in case anyone had any questions. I just want to thank you all for coming out. It's so nice to see people come to these programs. We certainly want to try and keep an open communication. We learn so much from you as you learn from us, and so that we can make sure that we direct our research efforts towards ways of improving some of these symptoms and problems that you deal with even years after treatment's been completed. So the question was, what are the recommendations regarding eating soy products? This is something that has been hotly debated, I believe, in the past. I will say this. There's no evidence to suggest that soy in a diet is a precipitative or causative factor for breast cancer. I will say that the reason that this came to be a belief is because soy products can have phytoestrogens, which I think were thought to possibly mimic estrogens. But there's no evidence that that's true. That being said, here's what we do know. We know that women in countries in Asia, places like Japan and China, have very high soy content in their diets, and they have less breast cancer prevalence in those countries. So at this stage, we don't particularly put any limits on soy products in diets. So things like edamame is one of the foods that's high in soy. However, there's a lot of diet supplements out there that are sold at places, sort of to promote weight loss. And when there's something like that that's not regulated by the FDA, and that when I look at the ingredients, there's some kind of soy product in the ingredients, and I can't be sure how much it is or where it came from, and it's not sort of a naturally occurring soy, that makes me somewhat ambivalent, and I would not recommend that because I just don't know what it is. I think that I'd have to look at each thing to know, what I think about what's in there. But naturally occurring soy in diet products like edamame, not of a concern. Things that I think you have to be careful when you buy anything that is not regulated and that doesn't have like a really good identification or definition of what's inside. It's hard to speak to. And they're so readily available and they promote all of these wonderful things. It makes it very hard to weed through what's actually useful and helpful. I often go to our, on the website for Memorial Sloan Kettering, there's, under integrative medicine, there's a website called About Herbs, where they actually tell you about most supplements, and they have evidence-based sort of information there. And that can be helpful in helping you decide what's right for you. So the question is, does anyone have any good insight or good ideas or had any good experiences with interventions for hot flashes? We always try and recommend non-hormonal remedies for management of hot flashes. I think that in terms of what works and what doesn't, it's a trial and error for each patient. Generally having some sort of regular daily exercise. I know that you've tried everything. Having some sort of regular daily exercise. Certainly wearing clothing that's easy to take on and off, non-synthetic fabrics, having access to good ventilation, avoiding things that can precipitate hot flashes, which include alcohol, spicy foods. Yes, certainly some people really suffer, and we don't know why it's worse for some people than it is for others. Some antidepressants like Effexor have been known to help some people. But again, it's sort of a trial and error. Not the same thing works for every person. Well, thank you so much for coming out tonight. I really appreciate your time. We learned so much from you, and the more insight you can give us to what your experience is like, I think the better it is for us to really have a sense of what's going on and try and figure out interventions and ways to manage. So thank you.